The premier global event for advancements in cardiovascular science medicine is back. Welcome to the American Heart Association Scientific Sessions 2024. Healthcare leaders from around the world are here in Chicago to discover the very latest innovations and research in cardiovascular health. I'm Dave Huddleston, and this is AHAtv, supported by Novo Nordisk.
The science of the role of inflammation in cardiovascular disease has evolved recently, creating an opportunity to increase awareness and education of systemic inflammation and its potential role in the pathogenesis of atherosclerosis, acute myocardial infarction, heart failure, and how it is specifically increased in patients who have chronic kidney disease.
With this booth, we wanted to make sure we were reaching the physicians in a way that was meaningful to them. And so the partnership between our team and the Novo Nordisk medical team was very tight.
The teams usually start a project at the very beginning of the life cycle in a fairly lo-fi way with pencil and paper, almost like a napkin sketch type of idea.
So we know where to look for most CV risk factors. Both doctors and patients are aware of them, things like cholesterol and diabetes. But other risks like systemic inflammation are less obvious, even invisible, and it's important not to overlook them. We needed to make sure that the booth was immersive and engaging, but it absolutely had to maintain scientific integrity.
Here we opted for almost like a circuitry feel to make it ownable and unique. And those kind of shapes and lines almost echo the human cardiovascular system.
It was really the spark and inspiration of BGB Group coming to us with visuals. It really just kind of came together. So from the build standpoint, this exhibit carries just about everything in terms of the latest technologies, from the magic mirrors to the reflective surfaces.
So we really want to kind of maximize that space for almost like a cinematic kind of approach to the imagery, where you have a kind of bold background and you've got very bright and vibrant graphics and typography and messaging.
So my hope is that bringing it together like this will serve as a spark to remind visitors of the applicability of the science to clinical practice.
So as you can see, this educational experience booth is the fruit of a lot of work and innovation. I welcome you to come visit us at booth 2542 to enhance your knowledge about the role of systemic inflammation in cardiovascular disease and challenge yourself by taking our quiz.
For more than 100 years, Novo Nordisk has been driving change. What have we learned? Helping to improve lives must go hand in hand with improving health and well-being. That people are more than their disease. That's why we have spent more than a century developing treatments to help people live lives less limited by their disease. A century of pioneering scientific breakthroughs in key areas. Today, we lead the way with transformational initiatives aimed at creating better treatments and a better world. Like you, we do it for the people who are living with, thriving with, and not being held back by disease. They are why we are investing in new, innovative medicines, why we are continuously expanding our offerings, why we are working toward an even brighter future. It's why, through the Novo Nordisk Foundation, we support scientific, humanitarian, and social programs. We are, and will always be, committed to driving change, to fight for the people living with, thriving with, not held back by disease. We call them the greats, because their disease doesn't define them. So what will? Novo Nordisk, driving change. Learn more about how Novo Nordisk continues to drive change by scanning these QR codes.
Only at Scientific Sessions can you find a robust program of scientific and clinical learning covering an array of important topics and specialties. The goal is simple: create healthier lives for people all over the world.
We get to talk to scientists, researchers, people that are actually working with patients. And so that's what I love about AHA is you get to really just hear all of the exciting innovations that are happening right now.
It's one of the biggest conferences in the world. We are here for looking for an experience at meeting the experts.
Friday's programming brings together AHA's international partners to tackle important healthcare issues facing patients everywhere, including cardiovascular and brain health.
A major focus of international's work, or of our international work at the American Heart Association, is to ensure that we act as catalysts, but that the learning is bi-directional. So it's not like, we know what works in the US and we're going to export this to other countries, but rather, what can we work on together?
Also Friday, leaders from Mexico, Asia, and the United Arab Emirates came together on the AHA stage to talk about evidence-based quality care, including a discussion on how to sustain and scale quality cardiovascular care. Speaking of collaboration, here at Sessions, you'll also find the world's leading journals here in Chicago, all coming together with the American Heart Association to discuss the very latest in cardiovascular disease and shed light on how that information is published.
The eagerness of people to get involved, I think, is really encouraging to see, particularly early career individuals.
The day I had the stroke, the pain was unbearable. The fear itself was unbearable. I remember that doctors were telling me they are trying to save me, but I just couldn't avoid to think that you didn't know how to control your weight through all your life. So today you die. I didn't want to be just remembered by pictures or by anecdotes. I wanted to be a present father, an influential father, but I knew I couldn't do it alone. I have learned to ask for help, and you discover that there's much more people than you counted on. It's not about being thin, it's just about being yourself again. Because as obesity is a disease, it's not your real self. I still discover myself every day, and I'm looking forward to see what's next.
As Scientific Sessions gets underway, we want to know what you're most looking forward to here in Chicago.
I'm very excited, I think, mostly about the late-breaking clinical trials, especially those that are focused on prevention. I think more importantly, this is a great opportunity to really collaborate, meet friends and colleagues from around the world.
I always look forward to coming to AHA because you get the latest science and also things that are clinically relevant to your practice.
So I'm looking forward to meeting people, meeting colleagues, making new connections. As a first-year resident, it's really important for me to advance my career in research.
This year marks an important milestone as the American Heart Association turns 100 years old. This year's Scientific Sessions programming features several sessions focusing on the legacy of the American Heart Association. It's a chance for us all to reflect on the progress made over the past century and look ahead to the healthcare advances yet to come.
I got to listen a lot from clinicians, from experts in imaging, as well as nurses in terms of the development and how we can improve in the area of congenital heart research.
We've come a long way in the time that I've been a pediatric cardiologist, which has been about 25 years, but we still have a long way to go. So the work is not done.
Speaking of the next generation of AHA leaders, Friday is Early Career Day here in Chicago. It's a chance for those still finding their footing to learn and grow into the leaders of tomorrow. The early career sessions were a hit here in Chicago, including a crucial talk about research programs, how to find your own path, and how the AHA can help along the way. And who doesn't want to get the most bang for their buck? Another popular session focuses on two vital aspects of career development: grant funding and getting the most out of the resources at hand.
It was such an honor to be on a panel of all women. We had 2 female moderators, we had all female scientists, and had amazing, engagement from the audience. People who are really coming out of this post-COVID era, and they want to do science, and that's so exciting for us.
Any session is worthwhile to come to at AHA, and this one is definitely very up-to-date for early career investigators and innovators, and for also postdoc and students.
Friday afternoon, we also got to see that research in action with a pair of sessions spotlighting young AHA-funded investigators and their exciting scientific research. Sessions like these also create vital networking opportunities and allow our early career professionals to interact and learn from the larger AHA community. All this, and we're just getting started here in Chicago as Scientific Sessions 2024 officially kicks off on Saturday. I'm Dave Huddleston for AHAtv, supported by Novo Nordisk.
Patients are more than their disease. That's why for over 100 years, Novo Nordisk has focused on treatments to defeat chronic and rare diseases and help everyone meet their moment. Your disease doesn't define you, so what will? Novo Nordisk, driving change.